Welcome to our community town hall at Maui Health. We appreciate you spending some time with us today. We've been through a lot together as this surge starts to finally fade on Maui. As always, we encourage you to ask questions. Feel free to call us by texting to us 214-3637. Text us your questions. We'd very much appreciate the opportunity to answer any questions you have. And I want to remind everyone, if you want to review this later on, you can always access us through Facebook too on our page. Well, the Omicron variant is going down. We're seeing real improvement at the hospital, but on Maui we're seeing big improvements too. Only 56 cases on Maui from the last statistics we saw. So the numbers are getting better, both at the state level and here in Maui. I also can share with you that our staff is very tired. We've been very, very busy. And it's not just the Omicron variant. This is the time of year where the hospital is traditionally busy during the winter. It's not unusual to see us almost full every day. So you add on top of that the Omicron variant, and the hospital has been very full. Every bed full sometimes for a period of time during the day. But I can assure you, we always have a bed for you. No one is ever turned away in the emergency room. The emergency room immediately takes care of anyone that presents themselves. The only thing that will happen is if you need a bed and to be admitted, there may be a little bit longer wait than normal while we discharge patients that are ready to go home for you to be admitted to the hospital. But there's absolutely no delay and give you the care you need. And this happens quite often during our busy time during the winter. Our employees, though, have done just an amazing job. Talk about heroes. They've been putting in extra hours. During the peak of the Omicron variant, our staff was just exhausted. I want to thank the government for helping us with FEMA workers. We received almost over 25 FEMA workers. That really made a difference for our staff. Their tireless commitment to our community is amazing. It's an honor for me to work with them. They're making a difference each and every day. People here on Maui taking care of people on Maui. It's truly an amazing, amazing group of people pushing themselves to do the right thing for all of us. I also wanted to share with you that the mayor did remove the requirement for boosters. So we are adapting to that. We still, though, have boosters available for you in our vaccination clinic. And the lady who runs our vaccination clinic, Christy, will be talking to you about that in just a little bit. I want to remind you, again, if you have questions, the number is 214-3637. With that, I'm going to ask Dr. Michael Shea, our Chief Medical Director, to give a few comments and update you on what's happening inside the hospital. Thank you. Michael?
Good afternoon, everybody. I'm going to keep my mask on if that's okay with all of you. I'm pretty loud, so you should be able to hear me pretty well. Thanks, Mike, and thank you, everyone, for being here today. I really appreciate the opportunity to talk with you. As Mike mentioned, we have been very busy in the hospital, and we're kind of used to that at this point. This is a very typical time of year for us to have a very high census in the wintertime and early spring. As the only acute care hospital on the island, we're actually busy much of the time. As part of our Emergency Operations Center team, we regularly monitor census, staffing, and supplies, and we have to remain nimble to meet the needs as they come up and quickly adapt to any new challenges. We've been really fortunate that we didn't have to enact any crisis protocols, as many places on the mainland and even on Oahu had to do in the recent past. We were very, very fortunate. With the help of our very talented clinical and support teams and the arrival of the FEMA and contingency nurses, we've been able to maintain normal staffing ratios throughout the last surge. Again, thankfully, over the last week, our COVID hospital numbers have been decreasing from our peak of 56. Today's number, we are down to 22. Only 2 of those are ICU status, neither of which is vaccinated, and only one of those 2 is on a ventilator also, obviously, unvaccinated. Of the 22, 9 patients were vaccinated. Only 1 had a booster. While there are vaccinated folks being admitted to the hospital, many of them are actually not having COVID symptoms. They are being admitted for other reasons. And actually, the number of boosters has been very, very low throughout this surge, and none of those folks have had significant COVID symptoms. So we call these incidental cases. What that means is, again, they're hospitalized for other reasons, but happen to have a COVID positive test when they come into the hospital, because we test all of the patients who come into the hospital for COVID. We expected a decline in cases because we've actually been following along with the HIPAM forecast models. That's a group out of the Department of Mathematics over at UH. They had actually projected the hospitalization peak at February 4th, which was very accurate, so I give them kudos. And our numbers have been dropping, as you saw today, pretty quickly, but the community positivity rate is still around 10%, which is rather high. So while we're happy the numbers are trending in the right direction, this is not the time to let our guard down. With expected gathering this weekend for a certain sporting event that will be happening on Sunday, I would urge everyone to continue to maintain the precautions you've been using for the last 2 years. Please use common sense and be safe. It would be really disappointing to have another surge just because we let our guard down. As Mike mentioned, getting vaccinated and specifically getting your booster dose is the best protection against getting really sick from COVID and from needing hospitalization. Be aware there's also a new variant on the horizon. This is a cousin of Omicron. It's called BA2. It's sort of like Omicron plus. Early research shows that it is more infectious, but so far it does not seem to cause more severe disease, so that's very good news. Vaccination is the most effective protection against hospitalization and death. Many people have asked, if I can still get the virus when I'm vaccinated, why should I bother getting vaccinated? Reason number 1, you won't die, and that's really important. Reason number 2, you won't need hospitalization, which is good for you and also really good for Maui Health, because we want to be able to do all the other things that we do for you that are not COVID related. Routine surgeries, delivering babies, all those things are really important. And if you can do your part to not stress our hospital system, we would really appreciate it. So there are several treatments available for COVID if you are unfortunate enough to contract it. They're available for folks who are at high risk for severe illness. There are oral antivirals available, as well as IV monoclonal antibody. Physician referral is not required, but it is encouraged. For more information, please visit our website at www.mauihealth.org. Our vaccination rate does seem to have plateaued a little bit. We're at about 73% completion rate of the eligible population, 5 years and older. We have the biggest vaccination gap in our children 5 to 17-year-olds. 5 to 11 is at 22.9%, and 12 to 17 is at 64.3%. All surges have proven that the majority of the community spread was stemming from children, and the inadvertent spread to more vulnerable adults in the community from children. So please get vaccinated, get your children vaccinated, get your booster doses, because that's what's going to protect you against severe disease. Be careful to avoid crowds, wear your mask, wash your hands, do all the things that you know how to do. We appreciate all the help that you've given us over the last 2 years. And with that, I'm going to hand things over to Chrissy Miller.
Thank you, Dr. Shea. As he mentioned, I'm going to go over, I'm Chrissy Miller, and I'm actually just going to go over the vaccine clinic and some updates. And as Dr. Shea mentioned, we're doing pretty good, but it's kind of come down with our vaccination numbers. So our clinic is still open. It's located at Maui Memorial Medical Center in the front lobby. We're open Monday through Friday from 9 a.m. to 12 noon and from 1 to 5 p.m. And we have been open since December of 2020, so we've been open for over a year now, and we've actually given over 82,000 vaccines. So we're really proud of our progress, and we want to continue to be open so we can continue to get that number up and vaccinate as many community members as we possibly can. And I just want to go over, how do you come in? How do you make an appointment with us? Or do we accept walk-ins? Who are we vaccinating? So one thing I want to mention, and please share this after you're done if you're listening, and thank you for listening, so we can get the word out, is that we do accept walk-ins in our clinic. So if you know people that haven't been vaccinated, they're trying to figure out where can they go, please send them our way. We accept walk-ins. You don't need to make an appointment, and we're vaccinating individuals that are 5 and up. So if you want to know who qualifies, all they have to be is 5 and up, and that's who we vaccinate. And for those that are minors, 17 and under, we do require that they come with their parent or with their legal guardian at this time. So yes, we accept walk-ins. If not, you do have the option of making an appointment. To learn more, visit our website at www.mauihealth.org/COVID vaccine. Some other reminders I just wanted to go over about the booster vaccine. Dr. Shea mentioned that if you had the booster, that decreases your risk of being hospitalized, having severe outcomes. So if you haven't received your booster vaccine, please do. So the booster dose is available to anyone aged 12 and older who has already had both doses of the Pfizer vaccine, and it has been at least 5 months since their second dose. And for the adults 18 and older that had to receive the Moderna, if it's been 5 months since your second dose, you qualify for that booster vaccine. If you got the J&J vaccine, you can get the Pfizer booster if it's been at least 2 months since your single dose of J&J. So if you were that individual, you qualify. The other question that we get is the booster dose. Do we really need to get the booster dose? I just really want to emphasize, yes, we highly recommend that you get that booster dose, because like Dr. Shea mentioned, it really helps with decreasing the severity, decreasing the outcomes that you have if you happen to get exposed or infected with COVID-19. So we do want to see you guys come in and get that booster dose. Other things that we just want to mention is that there's other tools that we want to continue to have you do. Wear your mask, test if you've been exposed, and yes, we do recommend that you eat healthy. Take care of yourself to keep your immune system up, but in addition to that, please take your vaccine. And again, we're open Monday through Friday, 9 to 12, 1 to 5 p.m. We accept walk-ins. We would love to see you, and that is our update on the vaccine clinic, so we hope to see you soon. And then after this, I'm going to go ahead and welcome up Marianne. She is our Chief Nursing Executive, and she's going to go over some updates with you on her side. Thank you.
Hi, everybody. Thank you, Chrissy. Aloha, and thank you for having me. I am Marian Horikawa Barth, and I am the Chief Nurse Executive here. As everybody's talked about, the hospital has been really busy, with this COVID surge, and our staff has done great stepping up. They've done an incredible job of caring for our patients and our community. A few months ago when I was here, I talked about an award that we provide to our nurses and it is real specific to nurses, that provide extraordinary care. And I wanted to give an update. So in December, we awarded our first Daisy Award to an exceptional nurse in the ICU named Sarah Salmonese. Sarah's story for her nomination was just really touched all of the committee's heart, and we had about 25 nominations, so it really was compelling. So her story is that she was taking care of a very ill patient who was slowly recovering, and this patient needed to walk and get out of bed and move around, and he just felt not well, so he didn't want to move. And Sarah had through conversations with him, found out that he really enjoyed dancing. And so Sarah danced with him. And it really touched our heart that she could made something that he liked to do into something that helped to his recovery. And this really, really helped to move this patient in particular go down that road to recovery so much faster and better. So just to talk about the DAISY just for a second, and the DAISY Award has been around since 1999. It is a acronym for diseases attacking the immune system, and it was made in memoriam for a gentleman named Patrick Barnes, who at 33 died from idiopathic thrombocytic purpura, just a really debilitating disease. And so his family was really touched with the wonderful care that Patrick received. And so for us, it's been here at the hospital and throughout the country, it's been a very rough few years, especially for our frontline nurses. I'm so proud of the nurses here. They provide extraordinary care, and this DAISY Award allows us to recognize them through a program that we are one of the participants of 5,000 national and international organizations. So today I ask you to please nominate one of the extraordinary nurses that cared for you. It is really an expression of gratitude, and it helps nurses cope in this really difficult time. Work is high stress, and sometimes people don't feel that people realize how wonderful that even in all this chaos of COVID and having lots of patients and very sick people, that the nurses still provide the same care that they provide every day. It also helps with burnout, because recognition is a way to feel that you are valued. These statements of gratitude really make a difference. And so I ask you to please visit our MHS website. You can nominate any nurse through that site, and it really will make a difference in the nurse's day, the nurse's year, but telling us about your experience. And even if they don't win the DAISY, it makes a difference just to hear from you and how much they touched you with their care. So I look forward to seeing your nominations. Thank you for your time. Please stay safe, stay well, and have a great rest of your day. Thank you.
Thank you, Marion, Chrissy, and Dr. Shea. Now we have time for some questions.
First question, are we in a worse situation than other hospitals in our state?
Well, actually, I do talk to all the other hospitals in the state almost every morning. We compare our census and our capacity, and we are actually in a better position than most of the hospitals in the state, both from a staffing standpoint and a capacity standpoint. I would say we are significantly better than most of the hospitals in the state, and I think a lot of that is because of our courageous staff that is doing whatever they need to do to take care of our patients. And we are very blessed to have a great facility, a great medical staff. We're in very good shape compared to the rest of the state.
Next question, have you canceled elective procedures? If not, why?
Well, we haven't canceled elective procedures, but we have talked to our surgeons about delaying or rescheduling elective procedures when it's possible. When we were at the height of the Omicron variants, we were very tight on beds, and we wanted to make sure that anyone coming in for elective surgery that may need a bed was really urgent. So we did talk to each surgeon, and on a case-by-case basis, sometimes if it was important and urgent, we did the case without any hesitation. If the physician felt that they could reschedule the patient, we did ask them to consider doing that. And right now, I don't think we have any restrictions on elective surgery.
I have one more question for you, and then we'll go to Dr. Shea. Has the hospital needed to implement emergency management protocols?
No, at this point, we have not been able to. We have an emergent center that's always, EOC, that's always up and running and responding to any concerns. The closest we came to it just before the FEMA nurses came, we were getting very close to a crisis situation with staffing, and we're very thankful the FEMA nurses came to provide us relief and assistance.
I think I have a question for Dr. Shea.
Dr. Shea.
Are there any treatments available for long-haul COVID? Are there any clinics on Maui?
I'm going to take this opportunity to talk a little bit about long-haul COVID, and then I'll answer the question. So many of you may have heard of long COVID or long-haul COVID. This is folks who have persistent symptoms, weeks, months, sometimes more than a year after they were infected with coronavirus. And those symptoms can be really mild. They can be things like a little bit of brain fog, a little bit of cough. Some folks have debilitating symptoms, severe brain fog, severe shortness of breath with minimal exertion, severe fatigue, making it very hard for them to get out of bed and do basic activities of daily living. So there's a wide variety of symptoms. The frightening thing about long-haul COVID is that studies are showing it's happening in anywhere from 25 to 35% of people who've had COVID. That's a really large number. We do not currently have any clinics on Maui. To my knowledge, the only clinics in Hawaii are at HPH and at Queens. You should talk to your primary care physician if you think you have symptoms. I have not seen any studies that show definitive treatments for this, but there are a lot of ongoing trials. There are a lot of folks working on that solution. So work with your primary care physician, see if you can get plugged in with the clinics if you have severe symptoms.
Next question for you, Dr. Shea. If the vaccines are working, why are many of those hospitalized vaccinated? It seems as if the number of vaccinated people getting hospitalized is going up.
So that's one of those partial truths. So yes, the number of vaccinated people in the hospital has been going up throughout the year. The reason is because so many of you have gotten vaccinated. That's great. About 67% of our total population, and I think it's 72% of our eligible population have been vaccinated. So if the vaccine didn't do anything, I would expect 72% of patients with COVID to have been vaccinated. And the fact is that we're seeing a much lower number than that. So the vaccine does work. It doesn't work, so it doesn't prevent catching COVID. There are breakthrough infections. We're seeing a lot of breakthrough infections. So it's not like the measles vaccine where you get the vaccine and you never get measles. In this sense, there are breakthrough infections. But the really good news is it does protect against severe disease, hospitalization, and most importantly, death.
I have one more question for you, Dr. Shea, and then we'll check in with Marion on the last one. What treatments are available for COVID-19?
Great question. So there are currently a few treatments under emergency use authorization from the FDA for treatment of COVID. There are 2 oral antivirals, and there is one IV treatment which is antiviral, and then there is one treatment for monoclonal antibody. So the IV antiviral needs dosing every day for 3 days. We typically reserve that for people who are inpatient. And then the other 3 therapies are available on an outpatient basis through Maui Health. If you are interested, again, as I had said earlier, we prefer physician referral, but you can find out information about those on our website. And there is a process to start the referral process on the website as well.
Thank you, Dr. Shea. Next question is for Marion. Ms. Marion, are most patients hospitalized for COVID or with COVID?
Yes, a really good question. we have had our fair amount of people who have come in with incidental findings for COVID, meaning that we test all of our patients as they are admitted to verify if they have COVID or not, and many of them have no symptoms and discovered that they are positive when we test them. I think that but we also have had more recently in this surge a fair number that have come in with COVID symptoms. So it's not scientific in any way, but it's about maybe half and a half or something around in there that have COVID, that come in with COVID. Okay. And I believe Mike is up to close us. Thank you.
Thank you, Marion. Again, we're very happy to see the Omicron variant is going down. We're seeing some of that pressure coming off of our staff, but we're not done with COVID. You still must wear your mask if you're out with strangers in large crowds, and we encourage everyone to get not only vaccinated, but consider getting your booster as well. Our vaccination clinic is open Monday through Friday, as Chrissy said, because we believe so much in protecting our residents, our friends, and our neighbors, and providing the vaccine to you. So please don't hesitate. We hope this was informative. We will continue to reach out to you to answer your questions. We thank you for spending the time today to listen to us and the time to ask us some of the questions that were on your mind. Thank you very much.